Imagine if the key to better mental health was something as simple as a mineral we used to drink every day. This mineral, often overlooked and misunderstood, has been quietly playing a role in our well-being for centuries. It's not a new, cutting-edge pharmaceutical, but rather something that has been part of our natural environment. Sound too good to be true. Let's talk lithium. This element, found in trace amounts in water sources around the world, has a fascinating history and an even more intriguing potential for the future of mental health treatment. Before the Industrial Revolution, we had a secret ally in our drinking water, lithium. It was naturally present in many water sources, and people consumed it without even knowing. This inadvertent intake of lithium might have contributed to the overall mental well-being of populations in ways we are only beginning to understand. But as modern water treatment advanced, this natural mood stabilizer got washed away. Coincidence or consequence? The removal of lithium from our water supply coincides with a rise in mental health issues, leading some researchers to wonder if there's a connection. Let's dive in. The story of lithium is not just about what we've lost, but also about what we can regain. By understanding its role in mental health, we can explore new avenues for treatment and prevention. Research has shown that lithium has anti-inflammatory effects, reducing brain inflammation that's linked to depression, bipolar disorder, and schizophrenia. This is significant because inflammation in the brain can disrupt normal functioning and contribute to the symptoms of these conditions. Yet, psychiatry has often sidelined it due to its side effects at high doses. High-dose lithium, used in the treatment of bipolar disorder, can cause a range of side effects, from mild to severe. This has led to a cautious approach in its use, despite its potential benefits. But here's the twist. Low-dose lithium, like the trace amounts we used to get naturally, might offer the benefits without the risks. This opens up a new realm of possibilities for its use in mental health care. In places like Oita Prefecture in Japan and West Texas, higher natural lithium levels in water correlate with lower suicide rates. This intriguing correlation suggests that even small amounts of lithium can have a profound impact on mental health. Imagine a simple mineral making that big a difference. The potential for lithium to improve mental health on a broad scale is both exciting and humbling. Lithium also boosts brain-derived neurotrophic factor, promoting neuron growth and repair. This is crucial because many mental health conditions are associated with reduced neuroplasticity, or the brain's ability to adapt and change. This is a game changer for conditions like depression and bipolar disorder, where neuroplasticity is compromised. By enhancing the brain's ability to heal and adapt, lithium could help alleviate symptoms and improve quality of life. Plus, it inhibits GSK3V, reducing brain inflammation and potentially warding off neurodegenerative diseases like Alzheimer's. This adds another layer to its potential benefits, making it a valuable tool in the fight against cognitive decline. So, why has lithium been overlooked? Despite its potential, lithium has not received the attention it deserves in the field of mental health. Concerns over side effects and a shift toward newer, more sophisticated drugs. The pharmaceutical industry could focus on developing new medications that harness lithium impacts in human physiology. Current medications manage symptoms, not the root causes. Current medications are designed to alleviate symptoms without addressing the underlying issues, thanks to the pharmaceutical industry. We've improved the life of many. What about exploring new compounds that can help with the cure? Low-dose lithium could be a safer effective alternative. By reintroducing lithium in small controlled amounts, we could harness its benefits while minimizing risks. As we face a growing mental health crisis, it's time to reconsider lithium's role. The prevalence of mental health issues is increasing, and we need all the tools at our disposal to address this challenge. It's not a cure-all, but it could be a crucial part of a comprehensive approach to mental health treatment. Lithium should be considered as part of a broader strategy that includes therapy, lifestyle changes, and other medications. The potential of lithium is vast, and it's time we gave it the attention it deserves. By exploring its benefits and understanding its risks, we can make informed decisions about its use in mental health care. Dr. Lado hopes to wake up the eyes of scientists and find new treatment approaches. His research is shedding light on the potential of lithium and encouraging others to take a closer look. Let's not overlook the elephant in the room. The potential of lithium is too significant to ignore, and it's time we brought it back into the conversation. Let's reconsider lithium and its vast potential for mental health. By doing so, we can open up new possibilities for treatment and improve the lives of countless individuals.